Dr. Naomi Adelson, who's a GP and co-chair of Greener Practice North London, and that's a network of public health professionals looking at environmentally friendly clinical practice, and she will share her perspective on air pollution in clinical practice. But to Dr. Naomi Adelson. Thank you very much.
Hi, everybody. And thank you to the previous three speakers for those really interesting presentations. And I'm now going to talk a little bit about the clinical implications of wood burning and PM2.5. So just to start off with a quote from an asthma sufferer. So this is actually a fellow GP that's written this. So she's a 54-year-old lady and that's had asthma for 20 years. Initially, she was managing well with just the occasional salbutamol inhaler, which you may know as the blue inhaler, the one which you normally just take in emergencies. But she's found her asthma worsening over the last 15 years. She's had to go on to a steroid inhaler, which is the preventer inhaler, the one that you take every day. And finds that normally she has to step that treatment up, maybe take a higher dose when there's a known trigger, which is usually an infection, a cough or a cold. She usually exercises by running regularly and finds that some environmental factors like sort of pollen or dust or whatever do make a difference when she exercises, but generally she's able to control her asthma well, able to still do her running and her day-to-day activities without experiencing too much breathing difficulty. But last year she had an experience where she stayed at a friend's house and they'd recently refurbished their house with and installed a wood burner. She'd taken all her usual asthma medications, but she found that after having a nice evening just sitting around the fire with her friends, she was coughing and wheezing and couldn't understand why at first. She upped her asthma inhalers, but still found that her symptoms only settled after she left the house. She hadn't had an infection or any other triggers. And she realised that the worsening of her asthma on that occasion had been caused by being around the fire. Next slide, please. So just also to mention the effects of wildfires. So I know Stephen mentioned the effects of the wildfires that are going on in California at the moment, and the fact that we'll probably be seeing the health effects of those in the months and years to come. So we rewind 5 years back to Australia's Black Summer, which happened between July 2019 and March 2020. This was a time of much worse wildfires than Australia usually experiences. 15,000 fires, 33 deaths, 3,000 homes destroyed, a lot of damage to wildlife and the natural world around, and almost 3 billion animals were estimated dead. So that's just a background of sort of the situation at the time and how bad the fire was. If you get to the next slide, thank you. So just some observations by doctors and patients of living and working in the area at the time, which I've taken from the article which I've linked at the bottom there. So doctors in the area noticed a lot more preterm babies with low birth weights, a lot more sort of gritty placentas in women with no smoking history. So a gritty placenta means that the placenta is much more calcified and struggles to get the necessary nutrients to the baby. It's often seen in women that may have a smoking history, but around the time of these fires, they're seeing lots of these gritty placentas in women who had never smoked. It was estimated that to walk around Sydney at the height of these fires would be the same as exposing yourself to smoking 37 cigarettes per day, and more in areas that were closer to the wildfires. They were seeing more babies born with breathing difficulties, more stillbirths than they would usually expect. And parents were noticing their young children developing wheezing and breathing problems sort of during and after the fires. Next slide, please. So if we bring it back to the UK and day-to-day practice, so in actual fact, this is usually more of an invisible problem. And we may not realise that we're being exposed to PM2.5 in the same way that we might do if we were living in an area where there were sort of wildfires and obvious wood smoke going on every day. Next slide, please. Nevertheless, PM2.5 is still having its effects, as we've seen in the previous talks. So this is just a diagram sort of with a reminder of the short and long-term effects of PM2.5. So we've got cough, breathing difficulties, eyes, nose, throat irritation, headaches, anxiety, skin irritations, allergies, respiratory tract infections, and then the longer term effects: diabetes, lung cancers, chronic respiratory and cardiovascular diseases, and strokes. And these things are all, presentations that my GP colleagues and I will see every single day in our clinics. Problem is that there are so many other possible causes that are contributing to these, many of which are more visible, things like mold, cold homes, other things that people may be allergic to, pollen and dust. And general stress of life. There are so many contributing factors to these conditions that often we don't think about air pollution or PM2.5. We may not think to raise this with patients, and patients may not realise that those things are contributing to their illnesses. Next slide, please. So as we all know, the NHS is under a lot of strain at the moment, and often we do hear people talking about sort of ways that we could meet the, increase capacity and meet the demand. I find it's maybe less common for people to talk about ways that we could maybe reduce the demand by making people healthier. So I just wanted to mention these sort of research done by Public Health England of the benefits to the NHS that we could experience if we reduced PM2.5 in the atmosphere. So Public Health England simulated the total cost to the NHS and social care of air pollution in England from a period between 2017 and 2025. And they found, well, the statistics are there, but so for conditions where there's a robust evidence of an association between the air pollution and the health condition, they've estimated that PM2.5 in particular cost the NHS £1.54 billion in that period. If they included other diseases where there was less robust evidence for the association between the pollution and the health condition, rose to £2.81 billion for PM2.5. Then there's also some modelling by the UK Health Forum and Imperial College London in collaboration with Public Health England, and they estimated that if we were to reduce PM2 or fine particulate air pollution in general by 1 microgram per meter cubed over an 18-year period, we could prevent almost 60,000 cases of coronary heart disease, 16,500 strokes, 9,300 cases of asthma, and 4,200 lung cancers. And there'd also be lots of co-benefits for health of reducing air pollution. So potentially increasing physical activity through encouraging more people to travel actively rather than in their cars, increased worker productivity, and improved health for vulnerable groups. Next slide, please. So this is a project called Knitting the Air, which is a community project in Poplar in Tower Hamlets. And it's a project to just raise awareness of air pollution, as it is, as I say, often an invisible problem. Next slide, please. So with the Knitting the Air exhibition, so they have a series of these rectangles with the pink or blue squares on. So the pink represents PM2.5. So each square represents a day. Each line represents an hour, and it's colour-coded to correspond to data from 2 Breathe London sensors to illustrate how much air pollution was going on in that area at the time. And so the darker the colour, the greater the pollution, and all the very dark pink lines represent the air pollution being over the UK legal limit at that time. And yeah, this project has helped people to realise the exposure that they are being exposed to. Next slide, please. So yeah, just to finish off with some ideas about what healthcare staff can do about this problem. And I think it's mainly about raising awareness really with both with our colleagues and with our patients, just about the impacts of pollution, how to reduce our exposure to it, and how to reduce the problem as a whole. So we could do that through staff education sessions, during consultations with patients, and then providing resources, maybe in our waiting room, posters, leaflets, and videos. And I've just linked there the Global Action Plan Knowledge Hub, which has got some brilliant resources for that. Next slide, please. And that's just an example of one of the leaflets on the Global Action Plan Knowledge Hub. Thank you very much.